Assalamualaikum and hi everyone. My name is Kamilia and today I will be talking about Echolalia and we will have a further discussion in the next slides. So let's see. So some of the things that will be discussed today would be definition of echolalia, types, diagnosis, etiology, and also treatments. So let's see. So what is the definition of echolalia? So echolalia is also known as echophrasia, which refers to non-voluntary repetition of another individual's speech. So for example, a mother or we ask our child, do you want tea or juice? So instead of choosing or answering, they either want tea or juice. They repeat our question, which is, what do you want, tea or juice? So it so the term echolalia is derived from the Greek roots echo, which means to repeat, and lalia, which means speech. So there are two types of echolalia, which is interactive echolalia and also non-interactive echolalia. So what is interactive echolalia? It is an attempted communication intended to be interactional, acting as communication with another person, for example, turn taking, verbal completion, providing information, and also requests. So, for example, turn taking, the person with echolalia uses phrases to fill an alternating verbal exchange. And then verbal completion is a speech used to complete familiar verbal routines that are initiated by others. So, for example, if people with echolalia are asked to complete a task, they might say good job while completing it, echoing what they're used to hearing. So, providing information, it is a speech may be used to offer new information, but it may be hard to connect the dots. So, a mother might ask the child what he wants for lunch, for example, and he'll sing the song from a lunch meat commercial to say he wants a sandwich. So, request is the person with echolalia may say, what do you want for lunch? To ask for their lunch instead of, can I have this for lunch? So, for non interactive echolalia, it is not intended as communication and is meant for personal use, such as personal labeling or self stimulation. For example, non focused speech, situation association, rehearsal, and self direction. So, non focused speech is when the person with echolalia says something that has no relevance to the situational context, like reciting portions of a TV show while walking around a classroom. This behavior may be self-stimulatory. So, secondly, situation association, which is triggered by situation, visual, person, or activity, and doesn't seem to be an attempt at communication. So, if someone says a brand name, product in the store, for example, and then they might sing song from the commercials. So third is rehearsal, which the speaker may utter the same phrase softly to themselves a few times before responding in a normal voice. So this may be practiced for upcoming interaction. And fourth is self-direction, which people might use this to walk themselves through a process. So if they're making a sandwich, for example, they might tell themselves to turn on water, use soap, rinse hand, turn off water, dry hands, get bread, put bread on plate, get lunch meat, and so on until the process is completed. So, how is echolalia diagnosed? So, echolalia is diagnosed through a careful review of the individual's experiences and past medical history. So, the clinician may also assess for the presence of echolalia through observation, such as directly, face to face, and video recording. So, other than that, if the individual is with a parent or a guardian, they may specifically ask the parent or guardian about the child if the child frequently repeats the words spoken by either um, friends or families, and then the parent can also offer support through telling or giving information. Either they would repeat words at school or at home, and then other than that, in the clinical setting, a speech language pathologist can also diagnose echolalia by having a conversation with the individual and observing their language skills. So some of the causes or etiology of echolalia, which also translates to underlying causes of echolalia, may include autism spectrum disorder or ASD. Secondly is Tourette syndrome, and third is stroke or head trauma for someone or an adult who experiences echolalia. Fourth is psychological or psychiatric illnesses such as schizophrenia and delirium, and then for neurological conditions such as dementia or epilepsy. Some of the treatments that can be done if your child has echolalia is first speech therapy. So a speech language pathologist will have a conversation with your child, and then they will find out the level of severity of your child, and then they will formulate a therapy plan as per requirements of the child to help them to learn how to speak or talk whatever they are thinking. Other than that, they also use cues pause point where the therapist will ask your child a question, and then the child has to wait for the doctor to ask them when to reply. And then sometimes the therapist will hold up the card and then ask or assist the child on how to answer. Second is medications, where antidepressant and anti-anxiety medication is prescribed when the echolalia is induced by anxiety or stress. And then three or third is practice at home, where when they spend more or most of their time at home, it is important to practice at home as well. So your child's speech therapist will suggest you various activities and also provide you with worksheets and visual aids to help your child practice at home. So there are also various online self-training programs available that can help your child to overcome their echolalia. That is all for me. Thank you. Bye bye.